refer to the downloadable guide at the bottom of the live stream window. If you have not yet registered, please register on-site at the registration link for today's webinar in the description box of Facebook Live or at the bottom of the live stream window for you to avail of a certificate of attendance. Registration is free and open to medical and allied medical professionals and students and lay observers. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step in order to receive your certificate of attendance. Make sure that your details are correct. The webinar lecture will run for 20 to 30 minutes. A question and answer portion will follow after. Ask questions by typing in the comments box in FB Live and YouTube Live, or by typing in the UP Manila Livestream Q&A box on the right lower corner of your screen. A link to an online evaluation form will be provided at the end of the webinar and will also be sent to your email address after the webinar. Wait for the confirmation email up to 2 days after the webinar. To receive email reminders to future webinars, please register at bit.ly/MewWebinars2020. For any other inquiries about the COVIDgilance webinars, please contact us at immunity.msps@gmail.com. View the previous webinars under the COVIDgilance series, including the first part of this series entitled Balik Tiwala, Balik Bakuna, Debunking Vaccination Myths, and the second part entitled Vaccination Timeline in the Midst of the COVID-19 Pandemic on our Facebook and YouTube channels. We would like to invite you to the next webinar of the Dr. Salvacion R. Gatchalian Memorial Webinar Lecture Series in Pediatrics, titled Management of Acute Seizures in Children. This will be held on September 8th, Tuesday, from 12 to 1 p.m.
We would also like to invite you to the webinar Diagnosis and Management of Subclinical Thyroid Disorders under the UP Med webinars, which will be held on August 26th, Wednesday from 12 to 1 p.m.
We are also hosting Munting Kwento, a virtual storytelling for kids and kids at heart, featuring a series of gawad panitikang pangkalusugan books that aim to promote good health and well-being among children. This initiative provides an avenue that highlights literary value and provides an alternative learning environment for children, especially during this global pandemic. Stay tuned for a new story every second and fourth week of the month. You may watch it on Facebook at tinyurl.com/MewHealAdvocacy and on YouTube at tinyurl.com/muntingkwento. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all available vaccines in the Philippines, 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Search Immunity Mu Sigma Phi Sorority Incorporated, and click Install. Welcome to today's webinar. For years now, Immunity, an ounce of prevention. One of the flagship service projects of the Mu Sigma Phi sorority has been conducting public health lectures dedicated to relevant and pressing health matters in the country. In response to the COVID-19 pandemic, we aim to continue disseminating information through Immunity's COVIDgilance webinars. In collaboration with the Dr. Salvacion R. Gatchalian Memorial Webinar Lectures, the COVIDgilance webinar series of the Mu Sigma Phi Medical Sorority, in partnership with the City of Manila, the Philippine Foundation for Vaccination, the UP College of Medicine, the Philippine General Hospital, and the Mu Sigma Phi Foundation present to you Immunization in a Time of Pandemia, a 3-part webinar series. Today, we present to you the third part of this series entitled How Immunization Will Keep Us Safe in This Time of COVID. This webinar is free and open to all. We are now using Facebook Live at MSPS Immunity and Facebook Live at tinyurl.com/MSPS-Immunity-Webinar. UP Manila Livestream. If you are encountering problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. For UP Manila Livestream, kindly turn up the volume using the audio icon. For other problems, please refer to the downloadable guide at the bottom of the Livestream window. If you have not yet registered, please register on site at the registration link for today's webinar in the description box of Facebook Live or at the bottom of the live stream window for you to avail of a certificate of attendance. Registration is free and open to medical and allied medical professionals and students and lay observers. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step in order to receive your certificate of attendance. Make sure that your details are correct. The webinar lecture will run for 20 to 30 minutes. A question and answer portion will follow after. Ask questions by typing in the comments box in FB Live and YouTube Live, or by typing in the UP Manila Livestream Q&A box on the right lower corner of your screen. A link to an online evaluation form will be provided at the end of the webinar and will also be sent to your email address after the webinar. Wait for the confirmation email up to 2 days after the webinar. To receive email reminders to future webinars, please register at bit.ly/MuWebinars2020. For any other inquiries about the COVIDgilance webinars, please contact us at immunity.msps@gmail.com. the previous webinars under the COVIDgilance series, including the first part of this series entitled Balik Tiwala, Balik Bakuna, Debunking Vaccination Myths, and the second part entitled Vaccination Timeline in the Midst of the COVID-19 Pandemic on our Facebook and YouTube channels. We would like to invite you to the next webinar of the Dr. Salvacion R. Gatchalian Memorial Webinar Lecture Series in Pediatrics, titled Management of Acute Seizures in Children. This will be held on September 8, Tuesday, from 12 to 1 p.m.
We would also like to invite you to the webinar Diagnosis and Management of Subclinical Thyroid Disorders under the UP Med webinars, which will be held on August 26, Wednesday from 12 to 1 p.m.
We are also hosting Munting Kwento, a virtual storytelling for kids and kids at heart, featuring a series of gawad panitikang pangkalusugan books that aim to promote good health and well-being among children. This initiative provides an avenue that highlights literary value and provides an alternative learning environment for children, especially during this global pandemic. Stay tuned for a new story every second and fourth week of the month. You may watch it on Facebook at tinyurl.com/MewHealAdvocacy and on YouTube at tinyurl.com/muntingkwento. We would also like to invite you to download the Immunity mobile app. It's a user-friendly, physician-guided health mobile app which features 1. An immunization record and tracker, 2. An information atlas on all available vaccines in the Philippines, 3. Frequently asked questions and myths on vaccination. It is currently available for free on Google Play Store. Search Immunity Mu Sigma Phi Sorority Incorporated and click Install. The webinar will begin in 15 minutes. Welcome to today's webinar. For years now, Immunity, an ounce of prevention. One of the flagship service projects of the Mu Sigma Phi sorority has been conducting public health lectures dedicated to relevant and pressing health matters in the country. In response to the COVID-19 pandemic, we aim to continue disseminating information through Immunity's COVIDgilance webinars. In collaboration with the Dr. Salvacion R. Gatchalian Memorial Webinar Lectures, the COVIDgilance webinar series of the Mu Sigma Phi Medical Sorority, in partnership with the City of Manila, the Philippine Foundation for Vaccination, the UP College of Medicine, the Philippine General Hospital, and the Mu Sigma Phi Foundation present to you Immunization in a Time of Pandemia, a 3-part webinar series. Today, we present to you the third part of this series entitled How Immunization Will Keep Us Safe in This Time of COVID. This webinar is free and open to all. We are now using Facebook Live at MSPS Immunity and Facebook Live at tinyurl.com/MSPSImmunityWebinar. UP Manila Livestream. If you are encountering problems in internet connectivity, kindly refresh the page. The webinars will be recorded and uploaded to our Facebook and YouTube accounts. For UP Manila Livestream, kindly turn up the volume using the audio icon, For other problems, please refer to the downloadable guide at the bottom of the live stream window. If you have not yet registered, please register on site at the registration link for today's webinar in the description box of Facebook Live or at the bottom of the live stream window for you to avail of a certificate of attendance. Registration is free and open to medical and allied medical professionals and students and lay observers. Once you have registered, the confirmation email will be sent 24 hours after the webinar. Please ensure that you complete this step in order to receive your certificate of attendance. Make sure that your details are correct. The webinar lecture will run for 20 to 30 minutes. A question and answer portion will follow after. Ask questions by typing in the comments box in FB Live and YouTube Live, or by typing in the UP Manila Livestream Q&A box on the right lower corner of your screen. A link to an online evaluation form will be provided at the end of the webinar and will also be sent to your email address after the webinar. Wait for the confirmation email up to 2 days after the webinar. To receive email reminders to future webinars, please register at bit.ly/mewwebinars2020. For any other inquiries about the COVIDgilance webinars, please contact us at immunity.msps@gmail.com. Welcome to today's webinar. For years now, Immunity, an ounce of prevention. One of the flagship service projects of the Mu Sigma Phi sorority has been conducting public health lectures dedicated to relevant and pressing health matters in the country. In response to the COVID-19 pandemic, we aim to continue disseminating information through Immunity's COVIDgilance webinars. In collaboration with the Dr. Salvacion R. Gatchalian Memorial Webinar Lectures, the COVIDgilance webinar series of the Mu Sigma Phi Medical Sorority, in partnership with the City of Manila, the Philippine Foundation for Vaccination, the UP College of Medicine, the Philippine General Hospital, and the Mu Sigma Phi Foundation present to you Immunization in a Time of Pandemic.
see it, a lot of people are now wanting to get or not get the vaccine, and everybody is really trying to figure out, would they really get the vaccine if the COVID vaccine would be here? Ladies and gentlemen, if I may have my first slide. Do you have it here, there? Because I just want to make sure that we understand each other why we need to have vaccination even in this COVID pandemic, when in fact we don't have yet a vaccine. Next slide. And this is my disclosure, just to let you know that I have been doing vaccine trials for the last 30 or 20 years, and more of clinical trials for more than 30 years. Next slide. And this is from different companies, including WHO and the Bill and Melinda Gates. So, as an executive director and founding president of the Philippine Foundation for Vaccination, which is now 20 years old, let me reiterate that our mission is to advocate, educate, and conduct research on vaccination as a means of disease prevention to improve the quality of life of children, adults, and their families. The vision is clear. We want to be the champions, and we engage you to be part of this for disease prevention. PFD envisions a sustained reduction in vaccine-preventable diseases for our healthy nation. And mind you, the last 20 years, next slide please. The last 20 years, the Philippine Foundation for Vaccination has been doing a lot to really advocate for. We've gone into vaccine missions, we've engaged media, we've even talked to policymakers, whether it is in Congress, in the Senate, to actually engage with our public health officials. And I think, you will hear about that also from our other speaker, Dr. Wilda, because we have really been quite friendly and really related, closely relating with the National Immunization Program since the 90s, when Dr. Flavier started the National Immunization Days. And so it is really a world of partnering, networking. Next slide, please. So that we will be able to really bring to our people what we need to do effective vaccination. Now, we all know we are in a midst of a pandemic, and globally, oh, by the way, this is last week when I was preparing the slides, and there were 21 million. Now it's more than 22 million coronavirus in the whole world, with more than 800,000 deaths now. That was last week, 773. Now, in the Philippines, we now know that there are more than, how many? Next slide, please. In the Philippines, our COVID-19 cases are now up to 194,000 cases with 3,100 deaths. That is of yesterday. And recovery is something like that. But we are not the worst in the world today. Maybe we are better than the USA, actually, but still, we need to do something about this. Next slide. We need to find out, do we really have the guts to suppress this virus that is really devastating our country? Because there's only one slogan now, and WHO says, and this I heard every time I listen to WHO, the thing now without the vaccine is we just have to suppress the virus. This is our goal now, until we have the vaccine. But of course, everybody is now racing, and we now know there are 200 vaccine candidates for COVID, and some 10 or almost 20 now are in human clinical trials. Because this is what we need. I don't think we can be feeling safe until we are able to say that we have the vaccine. Next slide. Because, ladies and gentlemen, believe it or not, next slide, we have to be able to, next slide, please. We have to be able, we are now on the benefits of the vaccine. We have to protect our individuals. when we do immunization, and although we are just saying we have no vaccine yet for COVID, we need to protect them against vaccine preventable diseases that we are already able to use. But somehow people cannot really be feeling safe. We need to review with you, remind you what are the needs, what are the values. First slide, next slide, please. The values that WHO tells us about the benefits of vaccine. First, and remember this, vaccines can protect against related diseases. So it's not only like, for example, you're going to protect against a pneumococcal disease. You can also protect against maybe the complications of flu or complications of measles, even if you only get the pneumococcal vaccine. So related diseases can also be benefited. Second, vaccines extend life expectancy. In fact, we owe it to vaccines that our lifespan has increased from a low of 40s in the Middle Ages. And now it's on the late 60s and even 70s. And mind you, in Japan, which has the longest lifespan, it's up to 90 as the number of life expectancy. And third, countries save costs through vaccination program. Indeed, you need to make sure that there are economic and medical cost when you are prevented from having the disease. Next slide. The fourth benefit of vaccine is that it can prevent cancer. The first vaccine against cancer, hepatitis B. And now we have, it's against liver cancer, you know. And then we have now the HPV, which is against cervical cancer, the number 2 cancer of women, even here in the Philippines. So there will be more in the future against gastric cancer or stomach cancer, even against breast cancer. They're all developing these vaccines that can prevent cancers. Number 5, vaccines enhance equity. You know, you might not really realize it, but those who have less in life, those who are in the underserved areas, in the communities, who are given the vaccines, are actually benefited much more because they cannot have the resources to be treated, unlike the rich people who can go to hospitals. So these rich people sometimes do not really care much about the poor people who can be benefited so much because they can now fight with something and will not bring them to the hospital. Next slide. Number 6 benefit of the vaccine is that vaccines prevent the development of antibiotic resistance. Did you know that by 2030, WHO predicts that if we continue with our use and abuse of antibiotics, that by the year 2030 to 2050, from 1/3 to 1/2 of patients who have infections will die because they are no longer responsive to antibiotics. And that is really a very devastating, very morbid thought to think about. With vaccines, you can prevent more diseases and less people will be using antibiotics that can actually bring about more resistance. Number 7, vaccines promote safe travel and mobility. Yes, don't you feel that if we had only the COVID vaccine now, that we may be able to travel again to other places in the Philippines or even abroad? That is something that I hope we will really realize, that it is the vaccination that can, even schools, you know, when you travel to your, not just in other countries, but when you want to be educated in another country, schools, education, vaccine could be the answer. Next slide. Number 8, benefit of vaccine is that it empowers women like us. You know, before, you know, in the olden times, Middle Ages, women did not have the voice. Women was just put in the corner and, they take care of children and cook and all that. But now with vaccines and with more people getting longer lifespan and with improvements in child mortality, women can now go out and be also part of the uh, workforce. The benefits really actually get into women empowerment. Number 9, vaccines promote peace. Did you know that they had to close in Afghanistan, Pakistan, because there will be a vaccination program? So they had to say, okay, ceasefire, because we don't want to have our health workers in the line of fire if you were to give vaccination. So it does promote peace. And of course, number 10, vaccinations contribute to economic growth. This, I'm sure everyone will realize, that with good health status, with no illnesses going behind the cost that medical and even indirect costs come in, that you cannot even work when you are sick. And the economy would really suffer, just like now with COVID. You can see how our economy is down. And this is not only for COVID. Even with other diseases, if we have measles outbreak, if we have all those dengue outbreaks, nobody would want to come out and do business with you. Even a country who was so devastated with so many illness, nobody would want to come to your country because you are so ill-stricken. You have so many illnesses. Okay, so next slide, please. Can we now, let's see. We go now to our next slide, which says vaccines are a victim of their own success. This is the problem with vaccines. They really reduce the diseases that they are aimed to neutralize. But with the passage of time, people just think, they're just complacent. They begin to think that they're saved, and then they don't get the vaccines anymore. When in fact, we know that if they don't get the vaccines, these diseases will just suddenly reappear. Just like what happened to the next one. Next slide, please. What happened to measles? Last year, next slide, please, we were devastated with measles outbreak. And this was because we actually had a lot of people getting vaccine hesitancy because of the fear of our dengue vaccine. And that was really mishandled, not just by our own scientists and our own government, but policymakers, by people who did not get the voice. And now we are slowly trying to restore that and trying to really build alliances and advocacy for a united voice. Just look at this picture. Don't you see all the national scientists, Dr. Domingo, all the people in government, Jean Solante, I can see Dr. S.P. Cabral, former DOH secretary, the scientist, Edsel, Congresswoman Anna York, they're all there to work together. And this is what we would rather see come together for our vaccine hesitancy to be restored. So, ladies and gentlemen, I really wish that we could work together, next slide, and really bring about the next part of our goal today. Again, in a COVID pandemic like this, we go back to what to do next. Suppress the virus. Next slide. How do we do that safely without the necessary immunization? We know that we have to reduce that COVID-19 transmission, and I'm sure Dr. Wilda here will tell us more about physical distancing and use of protective measures, going for restrictive mobility. Don't go and visit your grandparents, because that has been a very difficult time for us. What you need is to really make sure that you stay home, especially for senior or older adults like me. And when you want to have a medical consultation, there is now a need to schedule your appointments and maybe start doing advanced teleconsultation. Next slide, please. And we'll just, imagine what it is to really do this physical distancing and working hard. Next slide, please. To really come out and show that we do need to restrict. Next slide, please. Our movements. The new normal is really being laid out to us.
Okay.
Okay? But we are always going to tell you again and again and again that we need ways and means to undertake immunization even during this time when you have to use protective measures in place. And definitely in the last 5 months, we have been trying to tell everyone to try and come up with innovative ways to do immunization. Alternatively, in the outdoor areas, and we have seen some health centers going to basketball courts, going to the plaza, or having a more conducive way to do immunization. Screening and triaging of patients would be there. Having delivery care and even home visits will be there. Maintaining a good follow-up. And by the way, if you were to do immunization, make sure you don't forget to tell your patient when the next follow-up will be, when the next vaccination would be. And please make sure, next slide, that we are all working together on this. Even if you get tired in the midst of this pandemic, tell our patients, tell our people that we need to be reliable and credible in our information. Do you believe that the social media is helping us? That is a question, because many times social media could be a very important, or what is this? Sometimes they are the ones who deliver the fake news. Please, we say, think before you click, because there are many anti-vaxxer movement that is ongoing in social media. Of course, we know the tribe media, the TV, the radio, the newspapers are telling us something else sometimes. And we have to be able to distinguish and determine which are the reliable sources of information. And who are they? Next slide, please. Who are these reliable information sources? As I said, it could just be somewhere else. Next slide, please. It would be, most of all, next slide. Here are what, back slide, please. Here is what we want you to really remember. When you come out with your information, we need good scientific data, journals, the academicians, and medical societies even, to help us distinguish between fake news and the real scientific factual data that we need. Trust our DOH. They are the ones putting up all of the information needed that we have to rely on. And of course, we also come in and believe that we have the WHO to actually give us the global, the more nationwide, worldwide news. And you know what? Maybe some of you may be able to look at the data, and for the last 5 months, instead of doing telenovelas while in lockdown, you know what? The CNN has given me so much information that actually has something on COVID pandemic, also on the vaccines. Do you know that they actually are able to interview those who are in charge of the COVID vaccine, the CEOs of companies doing vaccines? You try it. It's a very important way to know and to really get some important news about the COVID vaccine, who are the ones in the advanced state of development of the vaccine, how many are there, and of course, importantly, how are the rest of the world faring with regards to the COVID and where we are at this pandemic. So, ladies and gentlemen, next slide. To cap it all, next slide, please. My take-home messages. In this time of pandemic, next slide, please. Can you go back to my take-home message? The take-home messages are, please remember the steps we need to do. Suppress the virus. By all means, if you have to stay home, stay home. Especially for the older generation, the 60s, the 70s, the 80s. That's how you can also suppress the virus so it doesn't get transmitted and you don't get the virus. The young ones, please do not visit your elderly, and even at home, please have that virus not be transmitted anywhere else. And then immunize against vaccine preventable diseases. This is what we need now. We don't want to burden our health system more than we need to. We need to immunize against vaccine preventable diseases. The third, please let us all help each other. There is a long way to go in order to really get out of this pandemic. But we cannot do that if we only look at ourselves and see ourselves as something, that will only be benefited by what we do. No way. To get out of mental illness or psychological depression, you need to help one another. You have to get someone else to help. And I think it will also make sure that our lives are really accomplished, because no one can do it alone. Not even Trump, not even President Trump, who always say he can do it alone. No way. Not President Trump or anyone else can do it alone. Please, let's all help one another. And last but not least, the biggest thing that will get us out of this pandemic is to listen to the experts. Ladies and gentlemen, we have to be scientific. We know that there are so many facts to be distinguished about, determine which is right and which is wrong. But we have to listen to the real experts, because, last slide please, because indeed we have to restore our trust, not only in our government, not only in our government health programs, but put our trust in vaccines, because indeed vaccines work. And our children may not have a voice right now, but that is what they want to say. Please help them have a brighter future, brighter for all of us together. Vaccines really work, and we are all in this together. Thank you very much. Last slide. I think my last slide is really to thank you for your attention, and God bless all of us. Stay safe, and please get vaccinated. Listen to the experts. Thank you. Over to you.
Okay, thank you so much, Dr. Bravo. I can feel the passion in your talk, and that was really a very informative talk, no? Ladies and gentlemen, this is Dr. Virginia Abalos, 1981. I'm speaking in the behalf of Immunity and the Dr. Salvacion Gatchalian Memorial Webinar Lectures. We're now going to proceed another eminent lecturer. Our second speaker for today's webinar is the current National Immunization Program Manager of the Department of Health. She obtained her degree in medicine from Fatima University, completed her residency in internal medicine at the Region 1 Medical Center of Dagupan City, and completed her master's degree in business administration at the Ateneo Graduate School of Business. At present, no, who can better talk to us, no? She is also the OIC Division Chief of the Children's Health Development Division of the Department of Health. She was formerly the cluster head and program manager of the expanded program of immunization of the Family Health Office Center for Health Development in San Fernando, La Union, and the cluster head for infectious diseases in the Provincial Health Office in Lingayen, Pangasinan. Ladies and gentlemen, here to enlighten us about how immunization will keep us safe in the time of COVID-19, we are honored to welcome Dr. Wilda Silva.
Thank you. Thank you, Dr. Abelos. Now I am tasked to talk about immunization services in the context of COVID-19 pandemic and how will immunization save us and of course help the entire healthcare system that is already burdened by the COVID-19 pandemic. So if I can have my next slide, please. All right, I would just like to show this to you, the coverage of the National Immunization Program. This is a national coverage for OPV1 or polio 1 and the third dose of polio as well as IPV. So this is one semester or 2 quarters of coverage from January to June 30, 2020. Ideally, we should have reached around 50% if our goal at the end of the year is to reach 95% or more. You can see some regions are doing better, while some regions are not doing so well. We can see here that particularly NCR and 4A, who have a lot of COVID cases, are not performing well as far as immunization, routine immunization for oral polio vaccine is concerned. Also for IPV. I think worthy of mention is Region 1, Region 2, Region 3, as well as Region 5, because they have reached more than 40% coverage for the first 2 quarters. Next slide. Okay, I think the measles coverage was deleted. So anyway, for the measles coverage as well, it's the same. 2 regions are lagging behind, NCR and 4A. And if I will be asked, what's wrong with regions NCR and 4A? Well, because of the implementation of a stringent lockdown in these areas, because of a high COVID-19 transmission, there is limited mobility and children are not brought to the health center to avail of this routine immunization coverage. Needless to say, if you will look at national coverage, it's in the 20s. No, we have a long way to go to reach that 95% of national coverage for both oral polio vaccine, inactivated polio vaccine, as well as measles and rubella vaccines. Next. Indeed, the COVID-19 pandemic has affected the delivery of essential healthcare services. But having said that, immunization is one of the essential healthcare services that needs to be continued. Despite the COVID-19 pandemic, the Department of Health in the first, right after the announcement of the lockdown in NCR, as well as some parts of Luzon or whole of Luzon, affecting also Visayas and the Mindanao regions, we drafted and circulated the interim guidelines for immunization services in the context of COVID-19 pandemic. This guideline is in accordance, parallel to the Interagency Task Force guideline to address COVID-19 pandemic. The National Immunization Program supports the efforts of the COVID-19 Task Force. That's why we are looking at their guidelines and aligning the guidelines issued by the National Immunization Program. So the salient features of this guideline, of course, is decision making. Decision making shouldn't come from above or from the national, but rather it should be a bottoms-up thing, because the local government units know what's going on in their locality. That's why we created several scenarios of COVID-19 and respond accordingly, provide immunization services if feasible. So for scenario 1, we can see here if the local government has no known case of COVID-19, they are placed under alert level blue, low risk for COVID, then we continue routine immunization services. However, we emphasize that even though routine immunization services in the health center is recommended, still we need to continue to practice infection prevention and control in alignment with the Interagency Task Force resolution to stop COVID-19 pandemic. Next. Now, we have scenario 2, or this is in areas or LGUs with no known case of COVID-19. However, there is a very high risk for vaccine preventable disease transmission leading to a possible outbreak and cause mortality from complications of the vaccine preventable disease. Then they will ask, are immunization staff, number of immunization staff adequate? Are vaccines available in the healthcare centers? In the past, this is not a question, but because of limitation of travels, limitation of delivery services brought about by the pandemic, then we have to ask, do we have enough vaccines in the health centers? Or are the health centers or are the vaccines just in Manila and cannot be delivered to the different islands of Mindanao and the Visayas? So if the answer to this is yes, then we continue routine immunization. We emphasize the under 1 immunization as well as defaulter tracking of under 1. We continue as well vaccine preventable disease surveillance, including measles surveillance as well as AFP surveillance for polio. All of these activities, despite COVID-19 pandemic, has to continue, and the local government units have to continue to analyze the COVID-19 transmission in their area and be guided by this algorithm in decision making. Next. So we have another scenario, which is scenario number 3. Now, if the LGU has confirmed cases of COVID-19, I don't know, Dr. Bravo, if there are still LGUs without confirmed COVID-19 cases. But I think some of the areas in the Visayas and in Mindanao, some of the barangays still do not report cases. So containment and community mitigation. 2 points here. If there is a low risk for vaccine preventable disease unlikely to become a large outbreak. And immunization staff are engaged in COVID-19 response because there are cases, they are doing surveillance. Even though there are adequate vaccines, then our recommendation is to suspend immunization activities temporarily until the situation stabilizes. When it becomes alert level 2 or alert level blue, then we proceed with the immunization services. Next. And then finally, we have scenario 4. LGU has confirmed cases of COVID-19, and this is under alert level red, sub-level 1. So containment and community mitigation again. You have two options here. No? Either you continue routine immunization services with emphasis on primary series vaccination for less than 1 year old at health center on a bi-weekly basis. Before, we were advocating that immunization should be every day, not just once a week, every Wednesday, not just once a month, no? But because we are in a different times, then a twice a week or twice a month vaccination, depending on the number of vaccinees in your area, then we will allow this. Outreach immunization services with emphasis on the primary series again. Why am I emphasizing primary series? At this time of pandemia, outreach immunization or catch up to under 5, we are not recommending this. But if feasible, if there are adequate number of immunization of staff doing the vaccination services, then by all means they can do it. But we are avoiding as well the exposure of our health workers who have been doing their job in not just providing immunization, but also assisting in COVID support. So primary series is emphasized here. But if they have adequate staff to provide immunization services up to under 5 years old, then if that is feasible, then that will be allowed as well, and that is better. So next. Now, there is an alert level 5 or alert level red, sub-level 2. Ito yung LGU has documented community transmission already, wherein there is a need to isolate that particular barangay or community or purok or street, wherein a stringent lockdown has to be implemented. And in these areas, whether the VDPV risk, vaccine preventable disease risk, is high or low, then we are recommending that routine immunization be suspended until such time that the containment measures have decreased the level of risk to alert level blue. The impact and appropriateness of the chosen options shall be monitored and reassessed on a weekly basis as the COVID-19 situation evolves. So it doesn't mean that for this week you are under alert level red, sub-level 2, you're gonna stay in that risk for the rest of the month. So a daily or a regular, weekly, I should say, a regular interpretation or assessment of the COVID-19 situation, as well as vaccine preventable risk assessment, is necessary for you to level up or level down in your immunization services. Next. So this is the summary of what I have talked about. It's just in a tabular form. Next. Okay. And I will share to you the good practice in some of the areas that actually posted a very good coverage for the routine immunization, as well as in the outbreak response immunization for polio that we did in Mindanao, in Calabarzon, and in Region 3. So one of the best practice that we observe that will give us a very good coverage is the support of the local government unit. I have been mentioning in the past, in all of my talks, that once the local government unit or there is a buy-in from the LGU, there is ownership of the immunization program by the LGU, then whether it is a campaign, whether it is a catch-up, whether it is a routine immunization, then the results would be very good. Especially now, because of the COVID-19 pandemic, you have to reassure your health workers. You have to provide them with the PPEs, and you have to provide them and remind them of hand hygiene, frequent hand hygiene, as well as, provide the necessary equipment and materials for them to practice IPC. Now, number 2 is a strong coordination between the district health offices, the barangay, and the utilization of our BHERTs, our barangay health emergency response teams. They have contributed a lot, as evident by the coverage, especially in lockdown areas. Next. Now, good practice again, support of religious leaders. Continuous coordination between LGU and the local interagency task force, because our LGUs have to be guided on the current protocols of the interagency task force for COVID transmission control. The Sabayang Patak Contra Polio, again, is a very good practice, or the strategy implemented in the Sabayang Patak Contra Polio is very effective because we did prioritize in this campaign. And because of this prioritization, the local government units, the implementers as well, were able to gain that knowledge of doing prioritization so that they can prioritize where to go first to provide the immunization services for the routine as well as for the catch-up. Now, we need to timely prepare and disseminate regional and sub-regional advisories to help our implementers. And once there is a good communication from up central office, sub-regional, regional to sub-regional, then everything will be smooth sailing. Timely preparation of messages to support the campaign as well as the routine immunization. I guess kudos to our HPCS, Health Promotions Office, because they have been doing a lot of messages, posting a lot of messages so that health workers will be informed. Next. Okay, BHW, our BHW, we thank them a lot. Our midwives, we also thank them. Why? Because they are the key actors in the campaign, in the routine immunization, in the catch-up. Why? Because they practically know everybody. They know where the children live. They know where the under 5s are. They know where the under 1s are. They know kung sino yung bagong panganak, kung sino yung nagbubuntis, so that they can provide timely vaccination to them. Barangay tanons, when you have an immunization activity organized outside of the health center, they are the crowd control managers. So at fixed posts, at outreach posts, they are very effective in controlling the crowd and maintaining that allowable physical distance, to provide the service, immunization service, and of course, maintaining that social distance to stop COVID transmission. Next. Now, increased community acceptance, ito yung sinasabi namin na program should not be conducted or implemented vertically. It should be looked at on a life course approach, life stage approach. So kung ano yung pwedeng ibigay kay under one, aside from vaccination, then ibigay mo na kaagad. Give that to the under one using the life stage approach. So in this COVID pandemic, we are also providing other services to our under one, giving food packs to the family, other services, health and social services. That's a big come on. Okay? And we need to orient. Sabi nga ni Dr. Lulu Bravo, according to Dr. Lulu Bravo, we need to re-educate our local leaders, our implementers, everybody on the benefits of vaccination. Next. And finally, this is my message. We must move as a country to curb not just the polio epidemic, because aside from COVID-19 pandemic, we have an ongoing polio outbreak since 2019, and we have an impending measles outbreak in 2021. So DOH cannot do it alone. We must move as a country to curb vaccine preventable diseases together. So thank you. Maraming salamat po. Mabuhay po tayong lahat. Over to you.
Well, thank you so much, Dr. Silva. That's very informative, and we believe that at least we know that our government is really doing a lot of things to improve vaccination in our country. At this time, we have 640 logged into our Facebook Live, and 78 in YouTube, and 16 at the UP live stream. We're now going to the more exciting part of our program, which will be the panel discussion and the question and answer segment. I am your moderator, and I'm going to speak in behalf of those who have sent in their questions. I think it was really emphasized that even if we push for our vaccination program, we should also take a look at the problems with COVID-19. So we should really strike a good balance between control of COVID and then pushing for vaccination. So this is a question for Dr. Silva from one of our viewers. Is going door to door to vaccinate people in our communities, is it considered safe?
Thank you. That is a very good question, because we have a lot of debates as far as that is concerned. But yes, I tend to agree with WHO and evidences presented to us that indeed door-to-door vaccination is safer than facility-based vaccination, wherein you cannot control the crowd. If there is no proper triaging in a facility, then the risk for COVID-19 transmission is up. But if you go door to door, provided that the health workers are properly equipped, wearing their PPEs. And by the way, the PPEs we recommend just include the face shield and the face mask. And of course, hand hygiene is very important. In between vaccines, you have to perform that hand hygiene. So my answer is yes. It's safer to go door to door than doing a facility-based immunization service delivery wherein you cannot control the crowd. But if you can maintain, the proper physical distancing, doing it in a well-ventilated area, and also doing it in a special area wherein you're not seeing sick patients or consulting sick patients, then facility-based is recommended as well.
Yeah, but Dr. Silva, I noticed that the immunization rate in different regions are very variable. As you mentioned, there are valedictorians, but there are also a lot of regions who are lagging behind. No, I was wondering because you were mentioning the door to door. Do we have like a process flow protocol that we, tell our barangay health workers that this is how you do it? Because sometimes if there are no leaders in the area, it would be good for us to just tell them what to do. Is the Department of Health, do you have such a thing, a protocol or a process flow?
Yes, there is a process flow. And as I have been emphasizing, the the coordination with the local leaders is very important. You know, somebody in the barangay level, if there is a vaccination team that will visit in that barangay, somebody has to make sure that all of the mothers with under one kids have to be informed. So number one, information, coordination with the barangay leaders, proper information of the proposed activity, and then of course the services, the logistics has to be there as well, so in the process flow that you've seen, that you had a glimpse on in my presentation, that's a process flow for facility-based immunization service, wherein there it should be a triage, and you ask about COVID symptoms. You ask about is the barangay where the child lives is high risk for COVID or not. So we have a process flow for facility-based immunization service delivery. Likewise, for community-based service delivery, or we call this outreach, there will be a guide, identifying first thing whether that barangay or that area is high risk or not. Because if it's high risk under red category or blue category, no, as long as there is high risk for COVID transmission, then we can delay. So these are all in the guidelines of doing immunization services in the context of COVID-19 pandemic.
I think there is a question also, I think a very similar question for Dr. Bravo in the context of the private patients. Like, is there anything that the PPS is doing, the PFV is doing to answer the vaccination needs of our private patients? No? Do we also go door to door, or do we do it facility based? So what are the current recommendations now of the society, Dr. Bravo? Yeah.
Yes, I think the PPS, the PIDSP, even the PISMID, and some of our medical societies have given out their position papers, and you can log on to their website to see their position papers and what they advise, their guidelines on immunization. I was just struck by your word of door to door. It's like door to door or home visits.
Yes,
Because it's
correct.
not really door to door. It's
Yeah.
like the packages that you bring. When you do home visits, and I think this is what Wilda was saying a while ago, and we have that. We have pictures of people, of the health workers going into a home visit, and Wilda just describe it, because I have heard some people criticize, some of these people who go to the house and say, oh, this could be dangerous. But just as Wilda said, I think, you have to
13
really make
hours.
sure that your PPEs, that you are you have your face shield, you have all the preventive measures, and those are the guidelines that are already in place. Just follow it, and you will be safe. The other thing about another one that I have seen the private sector do is a drive-through. I don't know, we have had that webinar that patients will come in their cars and the doctor will come out and do it. Well, as long as, again, we make sure that there is an emergency kit, or when you are vaccinating, you have to have with you the emergency kit. You never know, 1 out of 1 million can actually go into anaphylaxis shock, right? So you have to have your epinephrine, you have to have your emergency, and every vaccinator, and I'm sure the Department of Health has trained our vaccinators on this area, that they need to recognize at once anyone who will have an allergic reaction, anaphylaxis, or some hypersensitivity. I think these are all in place. And what we need to do is really just to make sure that every vaccinator, whether they are public vaccinator, the midwives, right? We do have midwives, and and our MHOs are very well familiar with a vaccination guideline. Kasi wag tayong mag-vaccinate if we don't know the actual precaution, contraindication, everything. Do not vaccinate just because somebody said, okay, you can vaccinate. Please log on to a vaccinology course that the PFV is going to put up in the next 1 or 2 months. We are now coming up, Wilda, if you may help us with this, we are coming up with a self-demand vaccinology course that they can click on and be certified on vaccination. Because this is really important. People are going to be kind of more safe or more confident if they know that the vaccinator who is giving the vaccine are well equipped, well versed, well knowledgeable, everything. It's an expert also on vaccination. So thank you.
That's a very, very good advice, Dr. Bravo. The fact that you can insert a needle does not make you a vaccinator, right? You have to know what you're doing. You have to know all the possibilities the moment you inject that needle into someone's hands, no? The idea of a drive-through is actually very, very popular nowadays. Remember, it was popular in Korea for the testing. I think it removes somehow the fear that you are not going inside the hospital. Even if a lot of hospitals already have very, very good triaging system, hindi kasi maalis kung minsan yung fear sa ating mga tao na, ay, hospital yan, madami yung COVID. So I believe this is something that some of us may emulate, no? The idea of a drive-through, if a good triaging system in the hospital may not be acceptable to some, but I think we can do both, no? There are a lot of questions here. Now, this one is about the COVID vaccine, but I don't know if we are preempting the Doctora.
That's another webinar.
Yeah, it's another webinar. Maybe just one sentence, Doctora Silva, because I believe this is more of a public health issue. Should the vaccine be made available, the COVID vaccine be made available, what is the plan of the government as to the administration? Do you have like people that you will vaccinate first, etc.? And do we already have earmarked? Have we earmarked the amount that we're going to spend for the COVID vaccine? Just maybe 2 sentences, Doctora. I know it's a little too early for that. Yeah.
Okay, I'll tell you a secret.
Okay, we like secrets.
Okay. 600 people there, huh?
The secret is, yes, there are ongoing talks about procurement of the COVID-19 vaccine once it's available. There is already an earmark fund. We requested the Department of Budget and Management already. We proposed actually the inclusion of COVID-19 vaccine in the 2021 budget for the National Immunization Program. But there are a lot of talks still on who will be vaccinated. Of course, as the proposal of the National Immunization Program is to align this with our flu pandemic plan, wherein you vaccinate first the most vulnerable, and who are these? Are the healthcare workers, the frontliners. We do not know yet as for the price of the vaccine. That's why we are still planning, and a lot of meetings are still ongoing. And yes, we are preparing for COVID-19 vaccination, but of course, the position of the National Immunization Program is we will wait for WHO advice on this one recommendation before we implement it on a public health scenario. So that's the secret about COVID vaccine.
Now it's not a secret anymore, Doctor. But I think that secret is something everybody would love to know.
But you
There is
know
a
what?
question. Uh-huh.
If I may just ask, because Wilda, this is something very very valuable that you are already planning something on how it will be rolled out, because it will need, again, as I mentioned earlier, the experts' advice, because you will need to see sino ba ang pinaka natatamaan ng COVID. Who are the most vulnerable group? Is it just the frontliners, or is it the elderly? And the economic cost that will be put in. And I think you need mathematicians here. You need the
Yeah.
health economist. You need the public health. You need the infectious disease. This is where, what we call the NITAG will be important to come in. It's not just one or two people who will be going and deciding this, right? So that's
Yes.
it. That's my sense, 1 cent's worth.
Yes,
Yeah,
that's
but
very true, Dr. Bravo. That's why we cannot go ahead with drafting the guideline without experts' advice on this one. And you mentioned NITAG. We are reorganizing NITAG 2021, 2023, kasi 2 years lang, diba? And we will be sending out invitations again. Because 2 years lang yung TORs ng aming NITAG members. So
yeah, I think
yes,
the point raised is very vital, because I am positive that we are not going to be able to vaccinate everyone, meaning to say cost effectivity, how we are able to deploy the vaccines that will make the greatest impact. That is, I believe, the message of Dr. Bravo. No, there is a question here. It's not really related directly to the lectures, but I believe it is a concern, and I would like any of the two to answer this. So verbatim, I'd read this. Good afternoon. Ask ko lang po, how to give pneumonia vaccine, PCV13 and PPSV23. Thank you po. It's maybe there are some confusion as to PCV13, PPSV23. So
May I just refer them to the Philippine Foundation for Vaccination recommended schedule of vaccination. The website is www.philvaccine.org. There is a updated, every year we update that from 2001 to 2020. There is an updated schedule of immunization, how you give your PCV13 both in children and in adults. Because it's a long, long way. Kulang na naman ng isang oras natin dyan. But you can try to log on. philvaccine.org. All the ones, the schedule, the recommendation for all, not just the PCV13, but for all the vaccines that you are going to give to your children, to the adults, to the health workers, they're all there. Please log on. www.philvaccine.org. It's a long story, so maybe you should really get there.
yeah, I would say it's a whole lecture, Doctora. It's a whole lecture. But maybe for Doctora Silva, most of the vaccination, the vaccines that you mentioned earlier were really geared more towards the young ones. No, do we have any programs now for the seniors?
yes, for the senior citizens, we have flu vaccination and PPV23 vaccination. So this is still not provided to all senior citizens, because we kind of earmark only funding for indigent senior citizens. We are hoping that in the next few years, this will be considered by PhilHealth as an individual based package or service package so that they can provide appropriate package for this one. For flu vaccination, yearly flu vaccination, and pneumonia vaccination for senior citizens. So since our senior citizens, 60 tayo dito sa Pilipinas, when you turn 60, you are gifted with 1 dose of flu vaccine and 1 dose of PPV 23.
So this is something that's ongoing, Doctora.
It's
And,
ongoing. It's
But,
since
it-
2013.
Yes, but if I am from the squatter area and I'm 60 years old, and so how do we advise our patients? Just go to your local health center and that's it.
Yes, the vaccines are available in all of the health centers, and also the flu vaccination. Once the vaccines are available, we give it right away to all of our implementers. But again, limited yung stock, limited yung doses because as I have mentioned, para sa indigent senior citizens lang. But for the PPV 23 vaccination, this is an ongoing, not just parang one time or isang month lang yung in-earmark for this vaccination, but it's available in the health center and all senior citizens indigent can just go there and avail of this shot.
Yeah, that's very good because, but I think it's also very important for us to know when to give the flu vaccine because the flu season in the Philippines usually starts July onwards. And I do notice that a lot of people will still be going to the centers quite late. Sayang naman, no? Kasi andun na yung vaccine, sana nabigay na natin ng mas maaga-aga. So maybe one of the things that we can do here is really a massive information campaign, no? There's a very interesting question here, Doctora, but this is again more public health. Bakit pagka nagbabagyo, nagkakaroon tayo ng messages sa ating phone, di ba? From the National Disaster. Oo. So, meaning to say, they are able to reach all our cell phones, no? So, can we not use this as a way also of health education campaign? Like, for example, May, June, July, we will already say, have you had your flu vaccine? Para ma-remind. Pwede ba yun, Doktora?
That's a great idea. Actually, we tried that. We are communicating now, working with our Health Promotions Bureau in the Department of Health because they are the ones, talking to our partners on how to disseminate information about all of the health programs, not just immunization, but all of the health programs. Napansin po ninyo siguro because I usually get this message last month or this month. I don't know when nutrition month is. Sorry. So